Hello, everyone, and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the Care You Trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. As always, if you have any questions or comments, please call us at 866-466-9734 or go to our website, which is fourseasonscare.org. Spell the number 4, FOURSEASONSCARE.org. Or certainly you can drop comments into the comments box from whichever platform you are viewing today, be it Facebook or YouTube. Well, I'm delighted, as always, to share my gratitude to the Van Winkle Law Firm for serving as the title sponsor this year for Ask a Care Navigator, Mondays with Maureen. The Van Winkle Law Firm is one of the most well-established and respected law firms in North Carolina, providing exceptional legal representation to individuals, families, and businesses in personal, commercial, business, and estate planning matters. And I particularly interface with this group on the latter. Should you want more information or to schedule a consultation, please go to the website, which is www.thewlawfirm.com, and someone will be happy to assist you. And that information will show up in the comments box below as well. Well, this is the first Monday in April, and I'm in spring cleaning mode. I don't know about some of you. So I thought I would do some spring cleaning about our health screenings. I know I share this annually to remind people to keep up to date with your health screening because I really believe it's that important. It's of vital importance: vitality, health, life, living well, and aging well. Regular checkups are important because health issues can be detected early. That's happened for me. Your medical provider can schedule preventive care for you and manage any existing conditions you might have, as well as give you personalized health advice. So helpful. I've tried to practice what I preach over these many years for myself. And interestingly, I meet a lot of people, maybe too many people, who say, I wish I had done ... something earlier in life. Don't be one of those people. Try. It's never too late. Try it now. And I want to share with you some recommendations. And all of this information comes from today from the American Cancer Fund. There's a wonderful website that talks about health screenings by age and gender. So let's just review them. And we'll start back in our 20s. We are adults then. And women, interestingly, as we go along, I'll share them with you. Women have more health screenings to do than men. You'll see. So in your 20s, ladies, you should have an eye exam, at least one between the ages of 20 and 29, a clinical breast exam every 3 years, a pap smear every 1 to 3 years, starting at age 21 or earlier if you're sexually active, and a pelvic exam yearly until the age of 25 if you're sexually active, then anytime you have new partners. And finally, a chlamydia test yearly until the age of 25 if you're sexually active. Wow, that's a lot. How much did you all know about that? For men in your 20s, you should have one eye exam, at least one, between the ages of 20 and 29, and a testicular exam, and ask your doctor, starting about that at age 18. Okay? Now in your 30s, women, ladies, continue those eye exams, at least 2 between the ages of 30 and 39. A thyroid test, something new, every 5 years, starting at age 35. Have you done that? And for your ongoing continuing care, the clinical breast exams, the pelvic exams, and the pap smears based on the schedule that you and your doctor have established. For men in the 30s, ages 30 to 39, have at least 2 eye exams during this period of time. Okay? Ready for the 40s? Here we go. In your 40s, women, have an eye exam every 2 to 4 years. For a bone density, ask your doctor about that if you should begin that starting at the age of 40. Just talk to your doctor about that. You should have a glucose test for diabetes every 3 years, starting at the age 45. A mammogram, yearly for women over the age of 40, yearly. And a thyroid test again every 5 years, starting at age 35. And then for continuing care for women, the clinical breast exams, the pap smears, and those thyroid tests. For men in your 40s, that eye exam every 2 to 4 years. That blood glucose for diabetes every 3 years, starting at age 45. That bone density test, talk to your doctor about that. Should you start that at 40? Men, a digital rectal exam. Ask your doctor about that, starting at age 40. And men, prostate screening. Ask your doctor about that, starting at the age of 40. You hear it's building up? Here we go. In your 50s, women, those colorectal screenings, yearly, that should have a yearly fecal occult blood test, or a flexible sigmoidoscopy every 5 years, or a colonoscopy every 10 years. But talk with your physicians, okay? And then for women, those ongoing continuing care exams, such as the eye exams, the clinical breast exams, the pap smears, the pelvic exams, the thyroid tests, remember every 5 years, starting at age 45. A bone density, talk with your doctor, and those blood glucose screenings. Continue the care exam screenings that you and your doctor have established. For men in your 50s, do those colorectal screenings, that yearly fecal occult blood test, or the flexible sigmoidoscopy every 5 years, or the colonoscopy every 10 years. So when you turn 50, the shift starts there toward the colorectal screenings. Really important. And that might start sooner for you if your risks are higher. For men, the continuing care in your 50s are the eye exams, bone densities, blood glucose tests, the digital rectal exams, and the prostate screening. It's a lot. Now, for the rest of us ages 60 and up, here are the recommended health screenings. For women, an eye exam every 1 to 2 years, starting at the age of 65. A lot of changes start showing up in the eyes during your 60s. Don't let it get ahead of you. There's so much that can be prevented. You want to be able to see the rest of your life. And for women in your 60s, do those colorectal screenings. Discuss that with your doctor in particular if you're older than the age of 75. I met a client recently who was in her early 80s, and for some reason, I forget what prompted her, but she insisted she have a colonoscopy at the age of 82. And sure enough, colon cancer was found. So talk with your doctor if you're older than 75. Women in their 60s and up, for the continuing care, the clinical breast exams, pap smears and pelvics, as you and your doctor establish. Those thyroid tests, really important for women. The bone density tests, really important for women. And the blood glucose testing on a regular schedule. For men in your 60s and up, do those eye exams every 1 to 2 years, starting at the age of 65. Again, a lot of changes happen in the eyes over time, and you don't want to wind up with an untreated glaucoma or macular degeneration. Get it soon. And for men in your 60s and up, for the colorectal screening, discuss those with your doctor if you are over the age of 75. Okay? The continuing care for men include the bone densities on the schedules that you and your doctor have established, the blood glucose testing, the digital rectal exams, and the prostate screenings. That's a lot. And believe me, there may be other screenings based on your risks or your established, your existing medical conditions that your doctors may be doing. Follow their recommendations. I see way too many people who say, I wish I had done something sooner, because things can be prevented or managed or treated very well. Well, all of this I pulled from the American Cancer Foundation website, which is associated with American Cancer Society. And there are other health screenings lists out there. I just thought this one was really interesting because it compared and contrasted the needs for women and men very nicely for me. So if you find yourself maybe thinking, oh gosh, when was the last time I did XYZ exam? Set up an appointment with your physician or your medical provider and review these recommendations. Okay. They want to keep you healthy too. You know, I talked about it last week. They really do want to take good care of you. Be a good patient for them too. Okay. So I hope this was helpful for you. And next week on April the 13th, 2026, join me again for another Ask a Care Navigator episode, because our community collaborator from the Van Winkle Law Firm, Heather Goldstein, will join us again. And she's going to have a very specific topic: protecting yourself from fraud, scams, and exploitation. This is a serious problem out there, particularly for seniors. So she's going to share tips with us on how to protect yourselves from frauds, scams, and exploitation. It should be fabulous. Next Monday, April 13th, 2026. Well, thank you for joining me today. Should you have any questions about anything that Four Seasons offers, please call us at 866-466-9734, or please go to our website. It's chock full of information, and that is fourseasonscare.org. Or certainly you can drop a comment in the boxes from the platform from which you're viewing. Thank you for joining me. It's always a privilege to share some information. Oh, and thank you to those of you who came out to the Age Well Hendersonville event this week. We really enjoyed visiting with you. Well, have a great day, and thank you very much. Bye-bye.